In HealthWorks, known for his phenomenal baseball stats, now Hall of Famer Tony Gwynn will be remembered for dying way too young. Chewing tobacco led to oral cancer, which took his life this week at the age of 54. Here's the good news. Dentists now have a new high-tech way to find oral cancer before it turns deadly.
Walking, talking, babbling.
What makes 38-year-old Cliff Zepchinski smile? His son, Parker, who just turned 1. And now Cliff wants to make sure he's around to celebrate many more birthdays with the little guy. But he's got a bad habit.
I've had a vice habit of smoking cigarettes for over 15 years.
Tobacco, in any form, is a leading cause of oral cancer, and that concerns Cliff. According to the American Cancer Society, every year, 37,000 will get oral cancer. About 25% will die from it. The key is finding it early.
Now, with newer technologies, we're able to find these things possibly earlier, detect things early. And when you find an oral cancer earlier, you have a very high success rate, up to 83% successful curable rate when you find them early.
Dr. Jeff Haddad at Rochester Advanced Dentistry is putting this new device to use. It's as small as a little flashlight. It's called Oral ID and uses fluorescent light to examine all the nooks and crannies inside the mouth.
It does help decipher between a normal piece of tissue and something that is changing. Doesn't necessarily mean cancer, but something that may be suspicious.
Cliff's exam goes well, but he knows he's got something to work on.
Definitely want to quit that habit and improve my health for the well-being of my son. So yes, it's anything to know that it's good right now is nice.
As far as how often you should get screened for oral cancer, the experts really don't agree on this. The American Cancer Society recommends screening when you visit your dentist. The problem is there can be many abnormal bumps in your mouth that are not cancerous, and that can lead to unnecessary testing. So your risk factors should really be considered when you think about screening. That's HealthWorks. I'm Dina Santafanti.